In this lecture, we'll be going over CNS vasculature with an emphasis on identifying the blood vessels of the anterior and posterior circulation with a little bit of clinical applications. In our 2 hours on cerebral vascular disease, we'll obviously go into that a lot more detail, but the goal is for you eventually to be able to apply these blood vessels to the anatomy that is supplied, and that you can localize the clinical deficits that will occur with an occlusion of any blood vessel in the brain. All right, so we're just going to kind of focus here on two blood vessels, the carotid artery and the vertebral artery. The carotid artery supplies what we call the anterior circulation of the brain, and that occurs via the internal carotid artery here. And we will follow this up into what we call the supraclinoid segment, where all of the important branches off of the carotid artery occur that supply the brain. Of course, we have the external carotid artery, which supplies the extracranial structures, but we won't say anything about that in this lecture. The vertebral artery travels up through these transverse cerebral foramina, which is important because in trauma, there can be damage to the vertebral artery. Carotid artery can also be damaged by trauma, but we'll talk about an important syndrome that occurs here with what's called a dissection of the vertebral artery later on in the course. And then the vertebral artery supplies kind of the back of the brain, the posterior circulation of the brain. So let's start with the anterior circulation. In terms of the internal carotid artery, we have a cervical segment, and then a petrous segment, which goes through the temporal bone, kind of an S-shaped cavernous segment, and then the supraclinoid segment, which gives off these important blood vessels that we will discuss. OPAM is a good way to remember the branches in order that come off of the supraclinoid segment of the internal carotid artery. Okay, so we have the ophthalmic, the posterior communicating, the anterior choroidal, the anterior cerebral, and the middle cerebral, respectively. So let's start with the ophthalmic artery. Here, this first branch, which supplies the eye, the orbital contents. In our neuro-ophthalmology lecture, we will talk about what happens if we have an occlusion of the ophthalmic artery. Next, we have the posterior communicating artery. So here is the internal carotid artery, and we can see all of these branches here that we're going to talk about. The ophthalmic artery, the posterior communicating artery, the anterior choroidal artery, the anterior cerebral artery, and then the middle cerebral artery. So the posterior communicating artery provides an important link between the anterior circulation, which is here, and the posterior circulation, which is back here. Remember, the posterior circulation comes from the vertebral arteries. Anterior circulation comes from the internal carotid arteries. And so this is important, as we'll discuss later, that we actually have a connection between the anterior and the posterior circulations. Right, the anterior choroidal artery is right here, and this blood vessel supplies the posterior limb of the internal capsule. Now, it's not the only blood vessel that supplies the posterior limb of the internal capsule, so there's overlapping blood supply here. It also supplies some anatomical structures we haven't talked about yet in the course, the optic tract, which obviously has something to do with vision, and the lateral geniculate body, which is also very important for vision. And it supplies the choroid plexus, which produces cerebral spinal fluid in the ventricular system. So later on, I will tell you what an anterior choroidal artery stroke looks like. Now, in terms of the anterior cerebral artery, this supplies the midline structures of the brain. So here is the anterior cerebral artery, and it loops around the corpus callosum here, and it supplies here this midline portion of the brain. Here is the paracentral lobule. And remember, that's motor and sensory for the leg and foot, respectively. And also the bladder is supplied here by the anterior cerebral artery. Okay, so you can kind of imagine occlusion of this blood vessel. Well, the patient's going to have some problems with the opposite foot and leg, and maybe some urinary incontinence as well. All right, so here we're looking at the internal carotid arteries, right? And so really all we can see here is, first of all, the posterior communicating artery here, and here it is over here. They're often very asymmetrical, okay? Here is the anterior cerebral artery, one coming from this carotid, one coming from the other carotid, and it continues up like this along the midline. And in the lab tomorrow, I would encourage you just to pull apart here the gyrus rectus so you can see the anterior cerebral arteries traveling up through the midline. Okay, so when we do a sagittal section, here's the anterior cerebral arteries. All of these are branches of the anterior cerebral artery. So it's going to supply here the superior frontal gyrus. It's going to supply the paracentral lobule back here. Now the middle cerebral artery comes out through the sylvian fissure and supplies the lateral surface of the brain. And there are multiple vital functions here that are supplied by this part of the brain. So the middle cerebral artery supplies the pre- and post-central gyrus on the lateral hemisphere. So remember, that's going to be face, motor and sensory, arm and hand, motor and sensory. Notice I put more than the leg because the leg is really along the midline. It's much more supplied by the anterior cerebral artery. Middle cerebral artery also supplies the middle frontal gyrus, and we've talked about the frontal eye fields here, so we'll discuss later what happens to the eyes when you have a stroke here. The middle cerebral artery also on the dominant hemisphere, so again usually the left, supplies Broca's area and Wernicke's area. Okay, and something else that we haven't shown you yet in class, but the optic radiations, which convey vision back to the occipital lobe, is also supplied by the middle cerebral artery. So you can see if someone has a large middle cerebral artery stroke, they could potentially have lots and lots of pretty severe problems as a result. So here's the internal carotid artery. We've already pointed out the anterior cerebral artery here. Here is just the beginning of the middle cerebral artery here, going out through the sylvian fissure. So to really appreciate this, we need to pull away the temporal lobe and see if we can find that artery. So here we've done that. Here's the middle cerebral artery, and there, here's the internal carotid artery, and here's the middle cerebral artery going out through the sylvian fissure, out to the lateral hemisphere. Okay, and if you cut off the tip of the temporal lobe, now we can really see the middle cerebral artery. It's a huge blood vessel. There's what we call a trifurcation here. And if we look on the lateral hemisphere, you can see the middle cerebral artery branches coming out and just supplying this huge territory. Okay, so again, here's the internal carotid artery. Here's the middle cerebral artery going out through the sylvian fissure. And in red, this emphasizes the supply to the lateral hemisphere. All right, but notice it also gives off these penetrating blood vessels as well along the way. And these are called lenticulostriate branches. And these are very important. Actually, the most common stroke syndrome that we see in neurology involves an occlusion of the lenticulostriate artery, or one of the branches. So the lenticulostriate artery supplies the internal capsule along with the anterior choroidal artery. But in particular, the lenticulostriate branches, you want to associate that with motor pathways. So it supplies the cortical spinal tract and the cortical bulbar tract. Remember, that's at the genu. And these are the motor fibers for the opposite face, arm, and leg. So that's very important distinction, the motor pathways in the posterior limb and genu. The lenticulostriate branches also supply a lot of the basal ganglia structures that we've talked about. And so here, just to emphasize, the lenticulostriate branches supplying posterior limb and genu of the internal capsule, And we can see they supply the caudate, some of the putamen, lots of important subcortical nuclei, but especially basal ganglia related. So as I mentioned, a stroke in the distribution of the middle cerebral artery can be quite devastating. And since the MCA comes off the internal carotid, as do all of the OPAM blood vessels, if you have a carotid narrowing, then patients can have quite a devastating stroke. So here is really a massive middle cerebral artery stroke on a head CT scan. Posterior circulation is supplied by the vertebral arteries, and we will see the vertebral arteries, once they reach the brainstem, give off the anterior spinal artery and the posterior inferior cerebellar artery, or the pica as we call it. All right, so here are the vertebral arteries. The vertebral arteries will come together and form the basilar artery, which supplies the pons with vasculature. But off of the vertebral artery, we can see the pica right here. It's always a very tortuous blood vessel, and it's going to supply the undersurface of the cerebellum. And look, here's the medulla right here. The pica actually also supplies the lateral medulla, something that will be very important as we'll discuss later. The anterior spinal artery comes off the vertebral here and over here, and it supplies the midline of the medulla. All right, so we have those two blood vessels. As I said, the vertebral arteries form the basilar artery, and the basilar artery, in addition to supplying the pons, gives off two other blood vessels that supply the cerebellum, the anterior inferior cerebellar artery and the superior cerebellar artery. Okay, so these are the three blood vessels that supply the cerebellum. The pica kind of gets the undersurface of the cerebellum. Follow the vertebrals up. Here's the basilar artery. And this next branch here is the anterior inferior cerebellar artery. And this supplies a lot of the middle portion of the cerebellum. And then if we follow the basilar artery up, here is the next blood vessel, the superior cerebellar artery. So this will supply the superior portion of the cerebellum. So the vascular supply of the cerebellum is SAP, superior cerebellar artery, the AICA, and the pica. So if we follow the vertebral here, coming together to form the basilar, but first on the vertebral we have the pica getting the undersurface of the cerebellum. Then here is the AICA supplying the cerebellum. And then along the basilar artery, it gives off all of these little penetrating branches to supply the pons. And then it gives off the superior cerebellar artery, which gets the superior aspect of the cerebellum. All right, the next blood vessel off of the basilar artery, in fact, the terminal blood vessels off the basilar artery are the posterior cerebral arteries. And let's just notice here an important anatomical relationship, that we have the superior cerebellar artery and then the posterior cerebral artery, and they kind of sandwich this blood vessel right here, nerve right here. This is the third nerve. All right, so the third nerve is usually very obvious here, so we'll look for those two blood vessels around the third nerve. So the posterior cerebral arteries, remember the midbrain is deep in here. So in our brainstem lecture, we'll talk more about the posterior cerebral artery supplying the midbrain, but it wraps around like this and goes all the way back to the back of the brain. So along the way, it supplies a lot of the temporal lobes and then most of the occipital lobes. So here's kind of a good picture showing you the vascular distribution of the posterior cerebral artery. The temporal lobe, especially the undersurface, and the occipital lobe back here. All right, one other thing here. So here's the third nerve, right? So even without looking at all of this, we know that the blood vessel underneath the third nerve is the superior cerebellar artery. The blood vessel wrapping around the top of the third nerve is the posterior cerebral artery. Okay, and then there's the third nerve coming out in between. Here is the important connection between the anterior circulation, internal carotid, and the posterior circulation. So this is the posterior communicating artery. And so there are just lots of important things here about the third nerve. This is really something that you need to know very well. From our lecture last time, we said the third nerve lies right next to the uncus, right here. So remember uncal herniation, we can get a third nerve palsy. Okay, then we said the third nerve is sandwiched between the PCA and the superior cerebellar artery. But actually the more important blood vessel that you link up with the third nerve is the posterior communicating artery. And the reason is aneurysms will often form right here off of the posterior communicating artery. An aneurysm is kind of like a focal dilation of a blood vessel that can get larger and larger, and when it reaches a certain size, it ruptures. And when that happens, that blood is going to push right on the third nerve. Okay? Why don't we talk about aneurysms of the superior cerebellar artery or the posterior cerebral artery? Well, just because aneurysms rarely occur in the posterior circulation. Aneurysms almost always occur here off here of the internal carotid, like along the PCA, and we'll discuss the other common locations for aneurysms later. Okay, so one other thing here about the posterior cerebral artery. I said that it supplies the midbrain, which is deep down here, but it also supplies the thalamus and the sensory fibers in the posterior limb of the internal capsule. So keep this straight, it will be an important distinction later. The motor fibers in the posterior limb of the internal capsule are supplied by the lenticulostriate branches off of the middle cerebral artery. The sensory fibers in the posterior limb of the internal capsule are supplied by branches off of the posterior cerebral artery. Okay, and I already mentioned the supply of the midbrain here. So here's a patient that had a posterior cerebral artery stroke. Here's a CT, we can see the midbrain. Kind of has these Mickey Mouse ears appearance. And so the posterior cerebral artery comes right around the cerebral peduncle here of the midbrain, supplies the undersurface of the temporal lobe, and then supplies the temporal lobe, the occipital lobe back here. And so we have this circle from all of these blood vessels we've just talked about called the circle of Willis. And rather than reading these, let's just show them to you here on a picture. So the circle of Willis is made up of the internal carotid artery, the anterior cerebral artery, here on either side, and a blood vessel that joins the anterior cerebral artery, and this is called the anterior communicating artery. So this is the anterior portion of the circle. The posterior portion of the circle is made up of the posterior communicating arteries and the posterior cerebral arteries. Okay? So who cares that there is a circle other than just to be able to identify it? Well, there is some significance of this. It's important actually that there is sharing of vasculature between the anterior circulation and the posterior circulation. For example, I have seen patients that have an occluded posterior cerebral artery right here, but they didn't have a stroke. So how can that be? Well, if the posterior communicating artery is patent, then the internal carotid artery here can divert blood into the posterior circulation and supply the posterior cerebral artery. Another common example is we'll see a patient that has an occluded proximal segment here, it's called the A1 segment of the anterior cerebral artery, but they didn't have a stroke. And as long as the anterior communicating artery is patent, then this internal carotid artery is able to supply both anterior cerebral arteries. So this circle of Willis actually does have an important function in terms of patients that have vascular disease, but yet are still, haven't had a stroke because of different vascular territories that are able to compensate. Okay, another nice drawing. This is from first aid showing you the circle of Willis, and I just wanted to point out here the lenticulostriate arteries here off of the middle cerebral artery. Now when you actually look at the circle of Willis, or if you try to take it off in our brain dissection lab, you can see it's not so nice and neat and straightforward as a drawing is. Okay, so remember with the third nerve, we have several relationships we want to make here with the third nerve. The first is it's sandwiched in between the posterior cerebral artery and the superior cerebellar artery. Next is it's right next to the uncus, so uncal herniation can compress the third nerve. And then finally an aneurysm here of the posterior communicating artery, when it ruptures, tends to involve the third nerve.